The Integrated Flow Hub is a collective team of system colleagues working together with a shared vision to improve the journey for patients, to support with discharge from hospital, to support with the progression of their pathway into some of our assessment units, and look at how we can get the outcome right for patients the first time. So I think collectively as a system team we recognised that there were improvements we could make to improve the patient journey around their length of stay in hospital, the processes that we really had control over, so decision making around pathways, and really coming together collectively to ensure that the discharge was as quick as possible and the patients went to the right place the first time. So we looked at the processes that we had in place and thought actually we can do this better. And we started with just co-locating everybody in the same building, in the same room, so that we were able to have dynamic conversations. You took away the delays that came about as a result of waiting for someone on an email or trying to get hold of them via phone. It meant you could have really in-depth conversations about patients who had really complex needs and come to a shared conclusion and start progressing on that pathway. So it's come about really as a result of really wanting to improve the patient journey and the discharge process for patients, particularly from the acute hospital.
This is a totally different approach, and I can only see the future where, like for instance, virtual wards, that I could link in with a virtual ward. I think it's about giving people the confidence to carry on their recovery at home in the right place for them.
They feel as though they get the right information at the right time, and it's allowed the social care team to be more positive and more focused in the work in terms of just looking at one aspect of that person's care, so looking at the here and now, and that's then allowed the community teams to pick up any work further down the line.
Patients can be treated appropriately at the right time in whatever department, both inside the hospital and outside close to their home, so pulling together all of the community-based services, all of the support services, and you know, we can fix problems. We can make sure that that is a seamless process that really draws in all those key agencies, third sector parties. You know, it is here, and we know what we can access for the benefit of the patient to get them out following their treatment as quickly and as safely as we possibly can.
Our work is to take referrals from the Flow Hub and from other teams. It's to help facilitate discharges. We work with the housing team in the hub as well, so white goods, moving beds, key safes, anything to facilitate an early discharge. We see patients on the ward from our referrals too, to help reassure them, ease anxieties ahead of their discharge. Well, I think we're that direct link between the acute setting and all community services, and that allows patients to have a continuity of care throughout, and thus should increase their hospital experience as well. The difference from seeing a patient on the ward, really anxious, really unsure about going home, to then after the 4 weeks we've spent with them, assisting them in the community, and then we have volunteers that can do another 4 weeks, so they're fully supported for a full 8 weeks if they feel they need to be.
Home First is part of the Integrated Flow Hub. We screen referrals that are received from wards for patients that are ready for discharge home but need some support when they go home and need an assessment to see if there's any long-term care needs or whether they could move on to our reablement service in the community to help them to become independent. So we feel that home is important for patients to go home and continue recovery because they're in their familiar surroundings, they can be back with loved ones.
I think it is important if they can safely be at home. Obviously some patients' needs are just too high for that to happen, but we do always try and advocate for home as our first option, and think what can we put in place to support them to return home really as our first port of call.
So ultimate aim of the Integrated Flow Hub would be to get the patient home where home is best for them, home to your familiar environment, your family, your pets, your own belongings, rather than a clinical setting, because home is the best place to recuperate and recover.
The patient is the most important thing to us, and their experience that is vital. They need to have a positive experience both in the acute setting. This will help them have positive experiences and with their onward journey in the community, and will ultimately help decrease readmissions, failed discharges, and allow the older people of Gloucestershire to live independently within their own homes for as long as they want to, and that's what we're about.
Having a shared vision has been fundamental to the success of the Integrated Flow Hub. So being able to collectively identify what we want to achieve together, how we can make the journey better for patients, and having that as our real goal collectively across the system has given us the opportunity to build processes and pathways around that. So we keep coming back to the principles around working collectively and collaboratively to achieve the right outcome for the patient.
It really has demonstrated how, if we work closely together and communicate effectively, then time taken to do normal tasks has reduced. We've had some real good benefits on average length of stay for a lot of our patients. We can escalate quickly, we can talk to the right people and the experts in their field rather than having to go through an intermediary. So really that seamless communication from start to finish. So my role very much is about the front door as much as it is the back door, so, and everything that goes on in between. So I think that's having this facility and the expertise in this room have been invaluable to start our improvement journey.